नमस्कार सब लोगों को। गुड इवनिंग। आप जहां से भी भारत से जुड़ रहे हैं या विदेशों से जुड़ रहे हैं, यू आर मोस्ट वेलकम हियर। एंड दिस इज अ वेलकम फ्रॉम सस्टेनेबल आरोग्य आवास फाउंडेशन। आई एम डॉक्टर सुजन राज. Most of you know me. Those who do not me, I really love to know about you also. Thank you very much for coming in. Today is a very special day. We have Dr. Rakesh Makwana, who is a like the expert in all our teeth. Is a dentist, and especially he gives the shapes to our face with all those techniques. So for a long time we were looking for some expert, and I found one of our family members in Sustainable Arogyavas Foundation, Shekhar, who told about like so much in depth about dentistry, and gives so many ideas that what according to his experience, what he has gone through, and how he is healing, helping his cells to heal him in different ways. And Dr. Rakesh Makwana played a very important role for him. I want to welcome Shekhar also to come and introduce Dr. Rakesh Makwana. Yes, Shekhar, please come in.
Yes. So, yeah, good evening to all, and thank you, Susan ma'am, and thank you, staff foundation and all other members, and Dr. Makwana. So, so basically, I will just come to the point right away. So, I had been having a lot of health problems since many years. Right now, my age is 36, and I was having a lot of health problems. And since last 6 and 7 years, I started to realize that dental issues are also contributing to it very slowly. Like the realizations, they they crystallized in last 2 3 years because I have had back pain for around 10 years and body asymmetry, a very subtle body asymmetry since childhood. And I was a very active child. I was playing sports, but slowly what happened through my college life, whatever I was trying, I was having a lot of injuries and many things. So, and also I was trying to find a solution to my back pain issue, which was supposedly from a disc bulge, but it was not healing. So all that journey led me, I mean, it is life's grace, to osteopathy, to Auroville, Pondicherry, and many stops are there. But in the last leg of that journey, what remained was, so there is a very beautiful science called osteopathy, which Dr. Rakesh Makwana also um, integrates in his practice, which is very central to his practice. But it's a whole body system which looks at the alignment and the spatial relations of all the body parts with each other. Basically, how are you properly aligned, how your structure is, and how it affects your health. And this is, I think, one of the biggest blind spots that we have in different medicine systems. So, in this last leg of journey, as I started realizing that my body's the structure, it was not just the spine, it was the legs, it was the face also. And then I started realizing that the structure of the jaws, the structure of the face, it's a very malleable thing, and it is so much connected to the overall well-being. And then in that journey, I was looking for different doctors, and then I met very amazing people. I was following Dr. John Mew from UK. So I came to Ahmedabad. There was a conference by him, and there I met Dr. Makwana. And also, yeah, and there is one very good doctor, Dr. Alka Banker. She had organized it. So I took treatment from her, and then some of the parts that she could address, she did address. But then again, it's a deepening of my journey. So I feel that now, now that I'm taking treatment with Dr. Rakesh, it's something that is very natural to the body, and the approaches he is following, it's like you will hear him and you will know that it's a mind-blowing approach. Like right now, I have some devices, some appliances which he has given me, and sometimes I don't even know that they are in my mouth, and my teeth are actually feeling stronger, not at all like braces. So when I found him, and it was a slow journey even coming to treatment with him, because I met him 2 years ago, but and we had talked in that conference little bit, but then it is something that you have to grow into. So what I would appeal to you all is that in today's talk you will be exposed to many things which are very important, but to be able to apply it in your life you need to immerse in it. So you need to keep following it. It is just an introduction. The science he will be talking about is very deep, and I am very fortunate and glad to have found him. And the journey is continuing. And he is. I mean, I was surprised. He is integrating not just the physical parts, the spiritual aspects as well, the psychological aspects as well. So very glad to have found him, and he's actually the only one that I know of who is doing this approach in India. And every time I go to him, there are patients either from Africa or Kerala or USA who are coming to him. Yeah, so we need at least thousands like him. Yeah. So with that, I will I hand it to you. Yes.
Okay, fantastic. Thank you very much, Shekhar, for that introduction. With your own experience, you got connected with Dr. Rakesh Makwana, and it is such a privilege and pleasure to have you with us here, Dr. Rakesh, and the stage is yours. Please go ahead and let us know what you want us to learn.
Namaste. Is my screen visible and am I audible?
Yes, sir.
Okay. To begin with, I will start with bowing to the Ishwar, the Almighty, who has always given me more than I deserve. I bow down to my parents. I bow down to my teachers, my gurus, who taught me all these things, whatever I am going to share with you today. I have learned those things from my gurus. So I bow down to my gurus. I bow down to the organizers of this webinar, the staff, Susan ma'am, Delphine ji, who has given me this opportunity to interact with you all. I bow down to all the participants who are there online today, and all the viewers, if this recording will be available, who will be watching this in future. And it is basically an connective endeavor where we all are destined to be on one platform. So with this, let us start with today's topic. Okay, coming to the topic, what we are seeing, if we see around in today's society, what is very common these days is people are getting headache very frequently, neck pain, back pain. Some people will feel very drowsy all the days, and some people will be very hyper all the days. So this is the scenario, this is the society in which we live. And just before a few decades, all these things were very common for the elderly people, those who are who have crossed their mid age. They used to have these issues, but nowadays all these issues are even visible in the kids, isn't it? So this is the society in which we live, and the question arises is why a dentist is talking about all these issues. It seemingly is not related with the dentistry, isn't it? But what is the connection? That's what we'll try to understand in the coming slides. Okay. So as a holistic dentist, we broadly divide our patients into two categories, kids and adults. And obviously the kids are the future. So let us start with the kids, that what are the issues with the kids and how can we help them? Okay. Now, if you see today's kids, if you go to any group all over the world, out of the 10 children, you will find that almost 7 to 8 children are having crooked teeth. They are having irregular teeth, isn't it? So, what do we usually do? Either the kids go to the dentist and they get the braces done, or something called as aligner. And we say that this should not be the first choice of treatment for these things. So when the child is having crooked teeth and when they go to the dentist, most of the times they are told that, okay, your teeth are crowded, so there is no space. And obviously the kids and the parents are consulting the dentist because they want the straight teeth. So they are told that either, because there is no space for all the teeth, either we will need to remove a few of the teeth so that the space will be created and your teeth will be aligned. Or they are told that, okay, if you don't want to remove the teeth, then we will shave off the few of the teeth. And then once the space is gained, we will align the teeth. But it is not advisable either to remove the teeth or to trim a few part of the teeth as a first choice. I think someone is scribing on the screen. We can see this red thing. If
somebody is scrambling, who is that? Please stop it.
okay, let us continue.
Yeah. Can you just go off and come back again on the screen and see if it can go?
Okay.
Very strange.
Is it okay now? Yes. Okay. So we say that it is not a good idea to remove the teeth in order to straighten the teeth, because these are the few of the examples. Like on the left side, these are the two identical twins. One of the twin was treated by removal of the teeth and another patient was treated without removal of the teeth. What you are seeing on the upper right corner is the sister who was treated without removal of the teeth, and the lower right corner is the sister who was treated with the removal of the teeth. As you can see clearly, the one on the top looks more youthful, more beautiful. The one on the lower right corner looks more aged. The screen is, you can see, the nose is also. So this is what happens if we treat the crowding with the removal of the teeth. This is another example. Again, identical twins. You can make out which one is which. The one on the right side, on your this left side is the one who was treated with the removal of the teeth, and the one on the right side was treated without removal of the teeth. You can see these are identical twins, and you can see the drastic change in their looks. And the variable is one was treated by removal of the teeth, another one was treated without removal of the teeth. Now these are non-identical twins, but they are still twins, and you can make out now after this few slides that which one is which. The one on the right side having well supported lips was the one who was treated without the tooth removal, and the one on the left side whose lips are not supported. This is the girl who was treated with the extraction and the braces. So you can make out the drastic change in the looks of these sisters, isn't it? So, see, when as a patient you are approaching a dentist for straightening of the teeth, you are primarily concerned about the looks of your child, isn't it? But when the approach is not correct, what can happen is, what we are seeing, that this is the girl, small girl, whose profile was like this, and when she was treated with the extraction, retraction, orthodontics, you can see that her profile has shrunken. The childhood profile was like this, and the shrunken profile was like this. So, what is the effect? Why are we talking about these things? What is the concern? Is it only the teeth? No. See, the teeth are connected with the bones. The upper teeth are connected with the bone called maxilla, lower teeth are connected with the bone called mandible. And when these teeth are taken inside, the bones connected with the teeth are also getting affected. So, what is the drawback? See, this is the lip profile of the patient. Inside the lip, these are the teeth. Inside the teeth is our tongue. And exactly behind the tongue is this airway. Okay. So, when either your child's jaw is small or your child gets extraction and gets retracted, what happens is the child's jaw will shift back, the lips will go inside. You have seen in the previous photograph, the lips are going inside. So why the lips are going inside? Because the teeth are going inside. And when the teeth are moving inside, the tongue which is there within the teeth, the tongue gets cramped. Now that if the tongue gets cramped, what will happen is the tongue has got no way to go but to go backwards. And when the tongue goes back, the child's airway gets obstructed. This is what happens. So we don't recommend the tooth extraction as the first choice. Now, this is an example of one of our patients. When she approached us, she was 30-year old. Now, this is the patient. She got a few of her teeth removed for her orthodontic treatment of the malalignment. And after a few years, she again developed this crowding. Now, she has already lost a few teeth. Now, what do? We again remove few more teeth and again straighten the teeth? Can we do that? Can we keep on removing the teeth for straightening the teeth? Is it the right strategy? So we have to understand that the teeth are not free. They are not independent. Like you cannot just move the teeth around and thinking that, okay, they are just the teeth and we are just moving around the teeth. And it has nothing to do with the rest of the body. No, teeth are not floating in the space. We have to understand that see, the earth is in the space, right? But even if the earth is in the space, it is not independent. It gets affected by the sun, and even the earth gets affected by the moon. And that's why we have different kind of waves coming into our sea. When the full moon day, the waves are different. When no moon day, the waves are different. So when something is out there in the space, that is also not independent. How can our teeth be independent? So the teeth are part of the head and skull. It is called skull. Okay, they are intimately connected with our skull. So whatever we do with the teeth, the skull is going to get affected for good or for bad. And if the teeth are connected with the skull is connected with the rest of the body. So whatever is happening over here will affect the skull, and through the skull, it can affect the rest of the body. And it is vice versa also. Anything that is affecting any other part of the skull, any other part of the body will also affect our skull. And once the skull gets affected, our teeth also gets affected. Isn't it? So what we are seeing in this slide is, this is the basin where the tap is open and the water is flowing over the top of the basin, and this gentleman over here is trying to wipe the floor. Now tell me, will this gentleman succeed in wiping the floor, will he be able to make the floor dry? No. Why he cannot make the floor dry? Because this is the leakage point. From here, the water is flowing down. So unless and until we work on this leakage point, yes, once we have closed the leakage point, then obviously he needs to come into play and he needs to wipe the floor so that the floor will become dry again. But without doing this exercise is going to be useless, isn't it? So I give this simile and I propose that there are 5 leakage points. Whenever we are getting any disease in our life, it is because of the one or more of these 5 leakage points. So what are these 5 leakage points? First leakage point is microorganism. If you get attacked by the bacteria or parasites, we get the disease. This is one kind of leakage point. Another one is structural imbalance. If our structure is out of the balance, we get the disease. Say, for example, if someone is in the middle age or old age is getting a knee pain. Now, most of the time, the knee pain starts with one knee. Now, the question is, if the knee pain is because of the age, both the knees are having same age, no? So why the person will have pain only on the right leg and not on the left knee? We hardly get this type of questions, that why only one. See, when we are using our hand, maybe some person will be righty, another person will be lefty. So who is righty will use more of the right hand. But this mostly doesn't apply to the legs. Mostly we use both of our legs in the same way. So why is it that only one leg will get the pain and another leg will not get the pain? The reason is structural imbalance. So this can be another leakage point, that is the structural imbalance. Third one is chemical. Under this will come all our nutrition, protein, fat, carbohydrate that we take, micronutrients like calcium and phosphorus and zinc, and all our hormones, vitamin D. This will come under the category of chemicals. When these chemicals are out of balance, we get the disease. When our hormones are out of balance, we get the disease. When we have some nutritional deficiency, we get the disease, isn't it? So this is third leakage point, that is the chemical imbalance. So when Susan ma'am is giving us this is Guru, Chela and Akela, so these are the chemicals which take effect on the chemical level. Yeah. So this is one of the leakage point that Susan madam is taking care of. Another one is psychological. We all know, we have read many times that more than 90% of the disease are psychosomatic disease. The meaning is, even if the disease is appearing at the physical level, it has got some roots at the psychological level. So we can have anything right from the hair of our head to the nail of our toe. Any part of the body can be affected with the psychological issues. So this becomes the fourth leakage point. And the fifth leakage point is the energy. What is the difference between a living person and a dead body? They have all the organs, everything, all the systems are there. Cardiovascular system, respiratory, everything is there. But what the dead body is lacking is the energy. You call it life force, someone call. So you can call it any name, but there is some energy that is flowing in a living person, which is not there in the dead person. Now this energy, it is not staying in some part. It constantly flows through our body. In Indian text, it is called as the prana shakti, and they flow through the various nadis, and the hotspot of these nadis are called the energy chakras. So when it is out of the balance, that's when also you can get the diseases. That's why the people who are working in energy like Reiki and pranic healing, they can also heal us. So what they do, they work on this leakage point, which is related to the energy. Now, for a second, if you close your eyes and think, any disease that we are experiencing will be because of one or more of these leakage points. It can be microorganism, structural imbalance, chemical imbalance, psychological issue, or energy imbalance. One or more will be affected, only then and then we get the disease. Correct? Now, we have discussed that, okay, out of the 10 kids, 7, 8 kids are having irregularity. That is very common these days. Now, I would like to know from the participants if you can think about what else is very common with kids these days. What do you see around and you find it very common these days, which maybe not there before 20 years, 30 years? With the kids, anyone would like to?
Yeah, in chat, cavities coming. Somebody say cavity.
Yeah, cavity. What else?
Yeah,
Anything else?
2 people, Mathali and Mrinalini and Bhavana saying cavities. Anybody else? You can put it on chat.
Supplement intake, eye-related issues.
Yeah.
Okay. What has changed the behavior? Yes, we are going to discuss what has changed the behavior. Speech issues, toothache. Yes. Sensitivity, hyperactivity. Yes, junk food. Root canal. Yes. Yes. So, what is common with the kids these days? Say the kids increasingly are getting very cranky. And we have heard this in many families. The elderly people are saying that we also used to have kids, but our kids were not this cranky. Isn't it? So kids these days are very cranky, they are very hyperactive, and they have very less tolerance, you know. So this is the very common issue with the kids these days. What else we are seeing is with the girls. Small girls, they maybe start to get their periods very early, and even in the teenage they start getting the issues with the periods. Their period become irregular, and there are many issues with the girls these days which were not that common before 20, 30 years. So these are few of the concerns that we should have as a society, and we will discuss about them in coming slides. We need to understand this, that just because something is very common, it doesn't mean that it is normal. Because something is common doesn't mean that it is normal. Now, let us start with the crankiness of the children. Now, when you think about a cranky child, we discussed about this 5 leakage point. Now, you tell me again the chat box that which leakage point will be first thing that comes to your mind when you see a cranky child. Which leakage point will be there? Come on, let us have some interaction so that we make sure that the audiences are also active. Energy, Mridal is saying energy. Yes. What else do you think when you see a cranky child? Psychological, energy, VIT deficient, vitamin deficiency, structural, chemical, energy. Okay. So see, when someone is cranky, yeah, the crankiness, the first thing that comes to our mind with the crankiness is psychological. There is some issue with the psychology, that's why the person is cranky. And now we will understand how a structural imbalance can lead to crankiness in our child. Now again, whenever there is a small kid, okay, the kid is very small, the kid cannot speak. So how do the kid communicate with the parents or the mother? The only way the kid can communicate is with crying, isn't it? So now again, please tell me in which normal situation the kid is not having any disease, okay, no problem. But in day-to-day life, in which situations the kid will cry? When the kid is crying, what the kid is conveying to the mother? Come on, we can see so many mothers here. Let us know what are your hungry, bring attention. Yes. Food. Yes, very good. Discomfort, weight, hunger, sleep. Excellent. So a small kid will cry mostly in two conditions. Either the kid is hungry or the kid is sleepy. Okay? If the kid is hungry, the mother will feed the kid. But after feeding also, if still the kid is crying, then some elderly will say, oh, the baby seems to feel sleepy. You make the baby sleep. Yeah. So in normal day-to-day condition, a small kid will cry when the kid will be hungry or the kid will feel sleepy. Now this sleep is very important in our life. Say we have many religions, isn't it? And the religions are advising us to do fasting. Now, some religions will advise that we do fasting for many, many days. Some religions say that you don't eat anything, you only have water. Like in Jainism, they have this fasting where they take only the water. In some religions like Muslims, they don't even take water during daytime when the Ramzan is going on. So various religions are having various recommendations related to our fasting. But if you take a close attention, the religions are telling you to do something with the food, but they are not messing up with the sleep. There are only a few instances where the night for the devotees are waking up for the night. That is called as a Jagrata or something. Jagran. But that is also only for a day or two, not more than that. Because the religions also knew that sleep is very important and they should not mess up with the sleep. So if you have a child who is throwing tantrum all the times, or a child who is misbehaving at school or at home, the child throwing himself or herself on the floor, the child is out of control without any trigger, or the child is performing poorly at a school, or if the child is having inability to conform to your directions or to follow the directions, the chances are that the child is having something called as sleep disordered breathing. Now, if you take 20 children, 10 out of these 20 children, 10 children are non-diagnosed as ADD, ADHD, that is attention deficit hyperactivity disorder, and 10 children are diagnosed with sleep disorder. If you combine those child and put them in a room, and if you invite a psychologist and to do some gross evaluation of this child, the psychologist will have difficulty in identifying out of this 20 child which child is actually ADHD and which child is having sleep deprivation. Why? Because classical signs of ADHD and classical signs of sleep deprivation, they are almost identical. So the child who is having ADHD and that child's behavior, and the child who is having deficient sleep, the child having deficient sleep will behave just like the child having ADHD. So there is a possibility that you see the data, you see that recently the children having ADD, ADHD has increased. The chances are that out of those children, many children are actually having sleep deprivation. So usually what do we do when the child is having this issue? Either we take the child to the pediatrician to fix the behavior, or we consult a clinical psychologist that please help us. This child is making his life and our life miserable. However, in addition to them, consulting them, you should also consult a holistic dentist. Now, here the question arises that holistic dentist is a dentist, and how a dentist can help us to fix the behavior related issues of our child. How is it possible? To understand this thing, let us understand the error related domino effect. What will happen? This we have already seen that whenever the child is having a small jaw, the tongue will go back and the airway will be affected, right? This we have seen. Now, when someone cannot breathe through the nose, the person, ideally, we are supposed to breathe through our nose. So when we are not able to breathe through our nose for whatever reason, the person will open the mouth and the person will start breathing from the mouth. That is called as mouth breathing. Now, when the person starts having mouth breathing, what happens is the person gets the higher arch. The arch are getting narrow and the palate will be high. And when the arch are high and the arch is narrow, the arch cannot accommodate the tongue. And the person's tonsils and adenoids also become enlarged. So all this will lead to a compromised airway. Now, what happens is when the child cannot breathe through the nose and when the child starts breathing through the mouth, the head as a compensatory mechanism, the person will have the tendency to move the head forward. Now, when the person moves the head forward, let us understand the body structure, how the body gets balanced. See, in a proper healthy balanced structure, the person's ears, person's shoulder, and the person's hip, they all will be in a straight line. But when the head gets forward due to inability to breathe properly, which is a compensatory mechanism to keep the shock going on, now this head moves forward, so it is off the gravitational axis of the person. And to balance the physical structure, as a compensatory mechanism, the person's thorax becomes rounded. Thoracic vertebra becomes rounded. And to compensate this compensation, the hip also gets displaced. So the curvature of the neck is exaggerated, curvature of the thoracic vertebra is exaggerated, curvature of the lumbar vertebra is also exaggerated. And the person is now likely to get the neck pain, upper back pain, lower back pain. There are so many people who are having lumbar issues. The reason may be their forward head posture. Because of the forward posture, the lumbar vertebra's curvature may have changed. But what we do, we take the X-ray or MRI of this lumbar spine and we start looking at it, but we forget or we don't even know that there can be the leakage point that is lying somewhere up in the stream, right? So when the child is having this sleep disordered breathing, the child needs actually an interdisciplinary treatment. If the child's tonsils or adenoids are already enlarged, because of which he is not able to take the proper breathing, the tonsils and adenoids needs to get addressed. If the child is having a tongue tie, the tongue is not able to move properly, then something needs to be done with the tongue. If the child is having allergies, we need to address that issue. And if the child is having narrow arches, we again need to address the issues so that ultimately the obstacles gets removed and the child should be able to take the breath properly, right? So every sleepy child or angry or misbehaved child should have a consultation with the holistic dentist so that to rule out if your child is struggling with the breathing during the sleep due to his altered oral structure. If the structures are altered or not, that's what the child needs to be evaluated for. So now, whenever there is the crowded teeth, the teeth will become crowded only when the jaws are not developed properly, isn't it? So when the jaws are not developed properly, we have seen in that animation that the tongue will get cramped and it will lead to the narrow airway. And if the airway is narrow, obviously the child will get less oxygen and child will get the sleep disordered breathing. And this sleep disordered breathing will lead to, because the oxygen will be less and sleep will be less. When you don't get proper oxygen, the brain does not get proper oxygen, the brain get irritated. And when we don't get the sleep, again we get irritated. So this will lead to behavioral issues like irritability. So the crowded teeth can lead to the irritability of the child. Now, why this thing is happening? We all have learned something called as evolution. So we have our ancestors were the monkeys, and we are evoluted as a human being, right, from the monkeys. This all we know. But what we are witnessing now is something called as devolution. Yeah, with the time we are now harming ourselves with many things, and that I call the devolution. Let us understand this with one example. What you are seeing in the screen is, what is it? It is the corn, right? Now, in the market, if you go and want to have some corn, what you get these days is something called as American corn. Yeah, it is called American makai, American corn, and it is very soft, and you are supposed to boil it and use it. Okay, so all the kids right now who are in school, they all have seen only one type of corn, that is this American corn. But the middle-aged people or the old people who are there in the audience right now, they must have seen something like this, which is called as desi makai. Okay, so this corn, it used to be hard, and we used to roast it on the charcoal sigdi. We used to roast it, and then we used to apply that lemon and some salt and some chili powder, and we used to have it with our teeth directly from this corn bhutta. This is what we used to have. Nowadays, at least in the city area, this thing is not available. I don't know if Madam can tell us if it is available in Chhattisgarh or not. But in our city area, even I regularly go and procure my vegetables and fruits from the organic market. And even in the organic market, this thing is not available. They all are selling this American makai only. So this is what we used to have. Now, if you compare it with this American makai, it is not roasted, it is boiled, so it becomes more soft. And after that also, people usually don't eat it with their teeth. It will be removed in a bowl, and some cheese will be sprayed over that, and it will be given to the child, and child is supposed to take it in the spoon, and that also the child is in mood, the child will have it, otherwise child will not have this also. Now you compare what exercise your jaws and the muscles will get when you use something like soft like this American boiled makai versus something like this desi roasted makai. You need to exert so much of force to eat this makai, isn't it? This corn. So when you have this type of hard food, your muscles get exercise. And with the muscle exercise only, your jaws get growth. Now, as this is not available, most of our kids are using something called as, we call it pre-chewed food. The food is so cooked, they don't need to chew it, they just need to gulp it. So when this is the thing, the exercise is not happening. When the exercise doesn't happen, the jaws don't grow, isn't it? So this is the effect of the food that we have understood how it can affect. So in nutshell, a cranky child, yes, they can have some psychological issues, but along with their psychological issues, they can have the structural imbalance, lack of proper jaw growth, because of which this child can be cranky, isn't it? So let us now understand this another scenario. We talked about these girls who are having, from the small age only, they are having many issues. Like there are so many girls these days, they are having painful periods. Now, see, the period is something that is physiological, it is not pathological, it is normal. Like the way we pass the urine or we pass the stool every day, it is not supposed to be painful. So this period also is not supposed to be, it is a normal process. No, it is not abnormality, it is a normal process. Some discomfort, some hormonal changes, we understand. But every time there will be the periods and the girl will be, having extreme pain and suffering with every period is very common. But as we said, because something is common, it doesn't make it normal. Before only just 30, 40 years, every house used to have 5, 7, 10 children. It was very common. Now, if you see around you in your family or in your friend circle, you will see at least one couple who is struggling to have a single child. You look around, there are so many IVF centers around us. Now, reproduction is natural, for any animal, any species, reproduction. Without reproduction, the species cannot survive. And these IVF centers are increasing, not only in the cities. I was talking with one friend, he was saying that now they are getting the patients from the village areas. This issue of reproduction has reached to our villages also. It is not now no more restricted to the metro cities. And we should have this wake-up call that why this is happening, something as simple as reproduction, why it is becoming so difficult for the human beings. So let us see, this is the issue, this is the common issue, and it is the social issue, and it is a serious issue. Now, when it comes to this period problems or the hormonal problems, which category it will come to out of the four leakage points: microorganism, structural imbalance, chemical, psychological, and energy. At first glance, because it is a hormonal issue, it seems to us that it is because of the chemical. Under the chemical heading, the hormones are coming. So it primarily is a hormonal issue. And it is correct also. But it also is having a structural imbalance connection. Let us see how it is. What is the connection? See, what you are seeing in this screen is this is the sacrum, and sacrum is surrounded by this pelvic bone. Now, in the pelvic bone, our genital system is located. For male genital system, female genital system, they are located in our pelvis. Now, if this pelvis, which is the outer housing of our genital system, if the pelvis is distorted, our genital system will also get distorted. In a distorted pelvis, we cannot expect our genital system to work naturally. We have seen this, that our skull is connected with the rest of the body and the skull is connected with the tooth. Now, there is something called as craniosacral system. What is craniosacral system? The craniosacral system is where this is the cranium at the top of our vertebra, and our bottom of the vertebra is connected with the sacrum. Now, they are intimately interconnected. Just understand this with this example of this string puppet. What we are seeing in a string puppet is when we are moving our finger at the top, the puppet at the bottom also moves. They are interconnected. The finger and the puppet, they are interconnected with the string. Something similar is happening in our craniosacral system. The cranium at the top and the sacrum at the bottom, they are connected with the string, which is called as dura mater. So now, because they are interconnected, what you are saying here in the figure is, if the occipital, which is part of the cranium, is dislocated in this direction, the pelvis gets dislocated in this direction. if the cranium is dislocated in this direction, pelvis also get dislocated in this direction. So dislocation in one part will affect the dislocation in another part. On the side also, this is the bone called as temporal bone. If the temporal bone is dislocated in this direction, the pelvis get dislocated in this direction. So when one part is having dislocation, another part also gets distorted. So how this hormonal issue can be connected with the teeth? We have seen that the teeth are irregular because the jaws have not grown properly. So the cranium is distorted. And when the cranium gets distorted, because of the durameter connection, the sacrum and the pelvis also get distorted. And if the sacrum and pelvis are distorted, how can we expect the genital organs to work properly? Now the thing is that we cannot see the pelvis of the children. You don't go to the go out of your house and see you see the people's pelvis, but you see the people's teeth. And if you correlate, see this irregular teeth, they have started appearing around before since only a few decades. And if you correlate, these hormonal issues are also increasing since the few decades. They have emerged together. The only thing is that we have not connected the dots. Once this industrialization has started and this kind of our food is replaced, like roasted makai is replaced with the American makai. So that changes has happened, and with that change, the more and more children are having the crooked teeth. This thing was not common before a few years, isn't it? And with in the same time period, these hormonal issues have also increased. They are interconnected. We are able to see the people's teeth. We are not able to see the people's pelvis. That is the only thing. But they are interconnected. So we have seen that these chemical issues is also there, but along with that, the structural issue is also there, which can lead to the imbalance of the kids, and they can have these hormonal issues. Right? So now here one question is there, that why traditional treatment modalities, which has been effective for thousands of years, might not be able to give us this cure to our kids, like our Ayurveda. Ayurveda is thousands of years old treatment modality, isn't it? So can Ayurveda help us here? Probably no. Why? Because this issue of crooked teeth, underdeveloped jaws, and distorted pelvis is a modern day issue. When Ayurveda was invented by our rishis, those times the people's lifestyle were different. People's food were different. And it is found in archaeological surveys that what we are getting in the skulls of our ancestors, they all had beautifully developed jaws. There were no small jaws or crooked teeth in our ancestors. So this was not the problem over there. So the solution, this is the modern day problem. So you cannot have the solution in something that is thousands of years old. Ayurveda is good. We are not saying it is not good, but this problem is not mentioned in Ayurveda because this problem was not existing there. Similarly, the other modalities like acupressure, acupuncture, they are also thousands of years old. But this is the modern day curse, we can say, because of our faulty lifestyle, faulty food, which was not there. So you cannot get the cure for this thing from those ancestral effective modalities. So what can you do at your end? Number one is breastfeeding. All the mothers who are able to breastfeed, they must breastfeed the kid at least up to first 2 years. We should not give priority to the, we see many mothers, obviously they might have some challenges. They need to join the work, and then the child is shifted to the artificial feeding and all those things. But then we pay a price for that. Naturally, breastfeeding is breastfeeding. There is no alternative to breastfeeding. And we will be seeing it in a little bit more detail in the coming slides. Next thing is, as soon as the child starts getting the teeth, you need to give them the hard chewy food. Nowadays, you get those ready-made, food in the market. You just add some boiling water and there is the slurry is ready-made and you just feed it with the kid with the slurry. No. Once we are getting the taste, we are supposed to chew it. So you give your child the carrot or meat and make them chew. When they chew, their muscles will give good function and they can have good jaws. The tongue should be at the correct position. We will see which is the correct tongue position. We have to control the pollution. See, one of the reason why the airway gets choked is the allergy. And the way we have changed our lifestyle, now we are even having more pollution indoor than the outdoor. Because the furnitures that we are using, those termite-free furniture and those paints which last for many, many years and all those things. So they are very much polluted. I challenge you that if you go to a godown where these plywoods are, they are putting the plywood. No, you cannot stay in that godown for 5 minutes. How these plywoods are made termite free? They are soaked into the chemicals, formaldehyde, and it gets dished out. So bottom line is you have to control the pollutant in your house. Your child, if the pollutants are there, the child will develop the allergy and the airway can be obstructed. Okay, and obviously yoga, pranayama, meditation, you don't have any choice but to do those things. Attitude of gratitude, humbleness, and a good quality family time we have to give for the psychological development of the child, right? So the crooked teeth, routine practice, we see that this is what is being done, but we have to understand that uneven teeth is not a dental problem. Uneven teeth is a problem of the improper jaws of our child's bones. See, if this is the bench and it has the capacity of 3 children, if you try to put 5 children in this bench, what will happen? That they will be sitting irregular. Only then they can be accommodated, right? So, what is the alternative? If you don't advise that teeth extraction, there is lack of space, what can we do? We have some holistic alternatives. Like in this example, what we are able to see is this child is having the plane of the teeth was like this. Before treatment, after treatment, it becomes straight. If you see the level of the teeth in relation with her nose, it is tilted. After treatment, it becomes parallel to the nose. In this, the midline, the nose midline and the teeth midline is not coinciding. Here, the nose midline and teeth midline, they are coinciding. Now you compare the profile of this kid before treatment, after treatment. Before treatments, you see that muscles are tight and the jaws are underdeveloped. After treatment, the jaws got the opportunity to grow. I call it flowering. When the bud is there and not able to blossom completely, this is complete blossoming of the flower. That's what we call it. We have to give the opportunity. The child has got the genetic potential to grow. Only thing is that we have to remove the obstacles and then the child will grow. Now, this is the front profile. You can see the jaw and jaw line and everything, isn't it? So when the child gets proper treatment, what are the benefits? Proper face and jaw growth, giving the balanced face structure and very nice looks to the child. Less discomfort, better function because the child will be able to breathe properly, well-developed airway. And with this, the child will be confident and they will be ready to face the challenges of the life. See, the challenges are going to be there in the life, isn't it? But we have to equip our child to face those challenges of the life. So how do we do that? We do that with something called as ALF therapy and cranial osteopathy. Now, what is ALF therapy? ALF therapy is nature-inspired holistic treatment. So before a few slides, we talked about the breastfeeding. Why breastfeeding is very important for the child's growth. We know that mother's milk is the best nutrition for the kid. But that is not only about the chemical nutrition. That is structural aspect to this. See what happens when the child is feeding. with the tongue and the lower jaw, mother's nipple is pressed upwards. And with that, the child will get the nutrition. Now, when this upward force is there, what happens is the patient's upper jaw is getting stimulation to grow in this direction. So the upper jaw and the lower jaw, upper jaw will grow, and when with the upper jaw, lower jaw will also grow. So that is the normal structure. When the child has this opportunity to breastfeed, then it gives this structural stimulation for the proper growth of the jaw. And when we give this bottle feeding does not give this structural stimulation to the growth, to the jaws of the child, right? And once the teeth are erupting, again, we need to give the child some solid food where the patient, with the child will use the muscles and the jaw can grow. So what is the correct tongue posture? Right now, we have 56 people over here. Now, where is the tongue? Is the tongue touching the palate or is your tongue down away from the palate? If your tongue is down away from the palate, then probably you are mouth breathing and your vagus now is not getting stimulated. So you are having less vagal tone, and vagus now also is distributed in our intestine. So probably you get the poor digestion for that and low quality of sleep, snoring, and you get the forward head posture. When your tongue is properly positioned on the palate, the correct position of the tongue is on the palate. When the tongue is correctly positioned on the palate, advantage is that you start doing the nasal breathing instead of mouth breathing. You start breathing through your nose. You get the good vagal tone. You get better digestion, good quality sleep, and with good vagal tone, good digestion, and good sleep, your nervous system also gets calmed down. There is the benefit of correct tongue posture. Our tongue is supposed to be up in our palate, like this. Okay. Now, how this ALF therapy is helping us over here is it mimics the nature. As the tongue is supposed to be here, this is the example of one of the appliance of ALF. When this appliance is inserted, the brain gets signal as if the tongue is in correct position. It acts as the artificial tongue. So whatever good signal the brain will get with the proper tongue posture, immediately once we place this appliance in the patient's mouth, the patient's brain does not know whether it is tongue or it is the appliance, but it gets the signals. This is the tongue in a better position, and the brain starts getting the signal, and brain starts behaving accordingly. So with this, it will also improve the function. How? Once the appliance is there in the position, the tongue will naturally go there. Tongue wants to fill the appliance. In order to fill the appliance, tongue will get to the right position. We don't need to instruct. Intuitively, the patient takes the tongue into the better position. So it improves the function. And once the function gets improved and the brain starts getting proper signals, the positive cascading effect starts here. And obviously, when the tongue is in better position and the appliance is also there, so gradually the form, the shape also changes. But you start getting the good results immediately. The appliance is there because the function is re-established. Ultimately, the function makes the form, right? Another thing that we do is cranial osteopathy. Now we all have this orange, right? So once we peel the orange, outer skin of the orange, what we see this white layer. With the white layer, the orange, the tissue is connected with each other, isn't it? So similarly to this white layer, there is something in our body that is called as fascia. So just like this white layer, our fascia is connecting everything from our head to our toe. Everything, our bones, our muscles, our organs, heart, lung, kidney, everything is covered with this fascia. And when we get any strain, any stress, it can be physical stress, you get the bump, you get some mental trauma, physical trauma, you get some energy trauma like those radiation and everything. With the trauma, the fascia gets strained. And with the fascia gets strained, in whatever part of the fascia gets strained, that function of that part of the body will get affected. like we have seen, no, that if this temporal bone is like this, the pelvis bone will be like this. So how did it affect? It happens, it affects through the fascia. They are connected with the fascia. That's why once this is distorted, fascia gets stretched and this also gets distorted. Okay. Now, in cranial osteopathy, what it believes is this: all the cranial bones, the teeth are connected with this bone called maxilla, and maxilla is connected with the other bones. Lower teeth are connected with the mandible, and mandible is connected with the other bones. And this cranium is having a constant rhythmic motion. It is called as cranial rhythmic impulses. It is just like our heartbeat. The heart is constantly having the motion. When we are breathing, our lungs are also having the constant motion. Similar to our heart and our lungs, the cranium is also having a rhythmic motion. It is called as cranial rhythmic impulses. And when this strains happens to our fascia, our brain is also having something called as durameter. So with the strain, the durameter also gets strained. And with that, the cranial rhythm gets disturbed because of the strains. So in this cranial osteopathy, this rhythm we establish. First thing is we release the strain in the fascia throughout our body. That is number one. Number two is we re-establish the rhythm of the cranium. So when the cranium's rhythm is re-established, the brain within the cranium also gets a smooth motion. So the brain becomes very calm. Just in 1 second, one session, you can feel that your brain is calm now. So that is number two. And number three is our energy chakras. So we end the session with the balancing of the energy chakras. Now that balancing the chakra and activating the chakra are two different things. We cannot activate the chakra. If you want to activate the chakra, you need to have some guru who will activate some of the chakras. We don't do that. What we do is we balance. So in cranial osteopathy, we work at three levels. The physical body's strain, which is there in the fascia, we release the strain. The brain's cranial rhythm we re-establish, and then we work on the energy chakra. So from the uh, sthul body to sukshma body, we work at all the three layers. So the person becomes balanced. Okay, that's what we do in cranial osteopathy. So we work with the patients with the ALF therapy as well as cranial osteopathy. So the ALF therapy work on the teeth and the cranium, and cranial osteopathy will work on the rest of the body. So the whole system gets balanced, and that's how we get the good result. Now we have seen that the whole body and the skull, they are interrelated, interconnected. Now this is one of the example. This patient was 40 plus years old. You can see that her eyes are at different level. The nose is crooked. The lips are also. And in the right side picture, you can see the eyes are well balanced. The new nose is better. The lips are better. Now this change from here to here is without any surgery. This is a structural change. There is no plastic surgery of nose or anything like this. See, you can do the plastic surgery for the nose, but can you do the plastic surgery for uneven eyes? Can any doctor attempt to level up the eyes? Is it possible? No. So this difference is through ALF therapy and cranial osteopathy. When we gently do the things, we can see the changes. This is the possibility. This is another guy. You see how his face was unbalanced and how the face has become well balanced. This is what we call flowering. They have got the potential, but there was some obstacle. It was not possible to attain the flowering, and this is what is possible. Another examples. Okay. So even if your concern is not about the teeth, you still may need ALF therapy and cranial osteopathy. Why? Let us say you are having, you don't concern about the teeth, you don't care about the teeth, but you are having back pain. Say for example, lumbar pain, or your sacrum is imbalanced. Now, if you try to do anything on the sacrum, you remember the craniosacral system. At the top is the cranium, the bottom is the sacrum. If you go to a good osteopath or chiropractor, you do anything on the sacrum, you get it into balance. But remember that on the top, there is the cranium and there is the teeth. If the teeth are imbalanced, even if you try to balance the sacrum, because the top portion is not in balance, whatever you balance, it has potential to get imbalanced again. So we can understand it with your bank locker. If you're having a locker in the bank, you need two keys. One key is with you as a customer, another key is with the bank manager. The bank locker can be opened only with when both the keys are utilized. If you only open one lock, your locker cannot get opened. So if you only work on the sacrum, but the cranium is not unlocked, you cannot get the good result. So even if your primary concern is about the sacrum, you need to get evaluated if your cranium and your jaws are imbalanced or not. If the jaws are not imbalanced, you settle your sacrum and you get the result. But if the jaws are also imbalanced, even if you only work on the sacrum, you cannot get result. You have to work on the cranium also. Only then and then the whole system will get balanced. It is all about the holistic thing. See, it is not a part. The part doesn't work in the human body. Everything is interconnected. So sometimes even if your primary concern is not the teeth, it is somewhere else. But if the leakage point is here, you have to work on the leakage point as well. Okay. So we have seen that there are 5 leakage points: microorganism, structural imbalance, chemical, psychological, and energy. Now, when we are using this therapy, ALF therapy in cranial osteopathy, it obviously worked at the structural imbalance. Yeah, because it is working on the rhythmic motion of the cranium and it also balances the vagal tone. It has good effect on the psychological issue. And because in the osteopathy session, we are balancing the chakras, so it takes care of the energy also. Luckily, we have in-house my wife, Dr. Bhumita Makwana. She is a homeopathic dietitian. So being a homeopathic dietitian, she can take care of the chemical issues also. Not cellular detox like Sujan madam, but other nutritional balances and homeopathy, we get some result with the chemical level also. So out of the 5 leakage points, 4 leakage point can be taken care of. And if all these four balances you have good structural balance, you have good chemical balance, your psychology also is good, and if your energy is good, the 5th thing, which is microorganism, will be very less effective for you. These 4 balances will equip you so much that you are less likely to get affected with the microorganism. If in the microorganism comes, your body can tackle those things because your body is well balanced now, isn't it? So that is what we call as holistic treatment. So crooked teeth are not just the teeth problem, they are more deeper effect on the child's overall health. And so whatever treatment you are giving, you have to make sure that it is not only aimed at the teeth. You have to make sure that whatever treatment is given is not having any harmful effect. If possible, it should have some positive effect on the overall structural balance of the kid, isn't it? Now we have got some questions Delphin ji had shared with me. So I'm going to answer those questions, and after that, if we have some time, and if there are some questions from the audience, we'll be taking the questions also. Okay, Susan ma'am?
Okay, great. Yes. Please go ahead.
So
Rakesh.
as the sequence I have kept as the Delphin ji have shared with me. So we are going to take them one by one. So first question was, we have heard that anesthetic products are harmful chemicals like graphene, and so how to bypass this? And even if we go to a dentist for simple cavity, they will use this product for pain. So that what to do? Are they all bad? Okay. So the first question itself is very tough tough question. Okay. So see, in Western countries, they have used something like this on the right side, which is called as uh, uh, these are the single-use cartridges. In India, majority of the dentists are using something that is there on the left, that is called as vials. So this is not single-use. You can have multiple injections from these vials. Now, if someone wants to add graphene to your local anesthetic, they have to be a very big pharma company. Now, majority of the dentists in India are using those vials. They are locally made. They are not internationally made. They are not imported. They are small manufacturers manufacturing this. So logically, it is less likely that they will add graphene to this. It is, even if it is happening, it is more likely to be happening into the cartridge. That is one thing. Second thing is that you don't need to get local anesthetic even for something like filling the cavity. Like in our practice, we always give this option to the patient that, okay, you need to get this cavity treatment done. We will drill the decay and we will fill the tooth. Now you have the option. Do you want to get the local anesthetic or you want to go ahead without local anesthetic? We give this choice to the patient. And whenever the patient chooses to wish to go without anesthesia, we go without anesthesia. And we tell the patient, don't worry, we are proceeding, and during the procedure, if you feel that you cannot handle it, we will give you the anesthesia. So first thing is, it is not necessary that you have to take anesthesia. You can go ahead without anesthesia also. As I said, it is less likely that the local manufacturer is adding graphene to this. Again, even if you are concerned that, okay, I don't want to get any anesthesia, but I need to get the treatment done, then there are some alternatives. Like you can get some acupressure done and get the treatment. You can get some acupuncture. In Ayurveda, we have something called Jalandhar Bandh. And I myself have witnessed one Ayurvedic doctor taking out the tooth without any anesthesia. They do the Jalandhar Bandh, the tooth becomes numb and they can remove it. And another option is hypnoanesthesia. With the hypnotherapy also, the tooth can get anesthetized and this thing. So if you are really concerned and you are afraid that about this graphene thing in the local anesthesia, these are the other options with which you can get the treatment done. Okay. The next question is, if we had one fully infected tooth and had to remove it, is it okay just not to replace it? Or it creates an issue? See, we have to understand that our structures are, they work the best when they are in balance. So let us understand this with this video. It is the dominoes effect. Okay. So say for example, see, this tooth is missing now. Okay. Now if this tooth is missing and if you don't replace the, see, the adjacent tooth are supporting each other and the opposing tooth are also supporting each other. So when this tooth is lost but it is not replaced, then the teeth can move from their position. See, you get it? So this, if this thing happens, then your jaw's balance get disturbed. And it can have the issue with the joint and it can get issue with the cranial rhythm. We just saw what is cranial rhythm. So it is better that you get the teeth replaced. Sure. Okay. Within 3 to 6 months, your lost tooth should be replaced to avoid this type of imbalance in the teeth and ultimately to the jaw balance. Next question is how to heal receding gum issues. See, receding gum issues majority of the time are because of the gum disease called as pyorrhea. So if the pyorrhea is there, you need to get the teeth cleaned and get those calculus removed. Okay. And once, because that is the deposit over there, that is the physical deposit. And you need to remove that physical deposit from there. Once the physical deposit is removed, then you can maintain it with whatever way you want. If you want to do some Ayurveda thing, some massage thing or some oil pulling, whatever you are comfortable with practices, you can do that. But whatever is the deposit there, that needs to be removed. If the tissue is damaged, that needs to be removed. Okay. What is the best toothpaste we can use? And the recipe you would recommend, or what is the best oral hygiene routine that you would recommend? Okay. See, there is no toothpaste is a magic. I give the example of the soap. See, whatever soap you use, it cannot change the skin tone, isn't it? The same way the toothpaste doesn't change. What is important is your brushing. cleaning, mechanical cleaning is more important. The toothpaste is just like the soap. It is not of much use actually. And if you want, you can use those for massaging the gums. You can use those powders, and but don't use. There are some people who use the salt. Only salt should not be used because that is coarse and it can attrite the outermost layer of the tooth, that is enamel. Okay, and the routine is, if your brushing is good, you can brush once a day. If your brushing is not good, you can brush twice a day. Along with that, it is better to have a warm salt water gargle, and you can also use something called as oil pulling. For oil pulling, either you can use the sesame seed oil, or you can use the coconut oil. Whatever you are feeling more comfortable with, you can do the oil pulling. That is, you take a spoonful of oil in your mouth, you keep swirling for 20 minutes, 15, 20 minutes, and then you throw it out. You don't swallow because it is supposed to dissolve the bad bacteria in the mouth, so you are supposed to spit it. And then the gargle, that is called as oil pulling. So you can do the oil pulling. Okay. Next is the documentary. The root cause talks about the long-term impact of the dangers of the root canal treatment. What is the truth behind this? And do they know that tooth actually cause adverse effect? Okay, I was expecting this question. See, you need to understand why do we need to get the root canal treatment done to answer this question. See, this is the tooth. This is the outermost layer of the tooth, which is called enamel. This is second layer, which is called dentine, and third layer is the nerves. Now, when there is a decay in the tooth and the decay enters to the third layer, your nerves get necrosed. Okay, and that is what will act as an infective foci. So they are the bacteria there, and they will keep on leaching uh, the chemicals which can affect your overall health. And so what is the documentary is saying is, see, there is something called as lateral canals. If you see here, in addition to the main canal, there are many different small canals that is also going out. That is called the lateral canal. Now, whenever we are doing root canal, we can only feel the main canal. That is also very small. But we cannot make sure that we have filled all the lateral canals. So lateral canal, that necrotic pulp can always remain there. So most of the people, unfortunately, what do they do? They see this series, the documentary, and they don't get the root canal treatment done. So please understand that when you don't get the root canal treatment done, it means that the whole of the necrotic tissue is there. See, they will apply some herbal thing, and the pain will go away. So they think that the pain is not there, so I don't need to bother. Okay, the pain is not there, but that necrotic tissue is still there, right? So if you get the root canal treatment done, at least the main necrotic tissue is removed. Only the lateral canal necrotic tissue is there. Majority of the tissue is removed. That is one thing. And if you believe that, okay, even if that small necrotic tissue is also there, that also I should not have in my mouth, then only option for you is that you remove the tooth. You get the tooth removed and you replace it with the implant. There is nothing in between. That you don't want to get root canal treatment done, but you don't want to have this necrotic tissue also. Not possible. You get the root canal treatment done, majority, more than 90% of the tissues are in the main canal that get removed. Only few small percentage of tissue is there, which is in the lateral canal, which cannot be negotiated. Today, with whatever technology we have, we cannot make sure that all the lateral canals are negotiated. Okay. So please, if you are afraid after seeing that documentary, don't keep the decayed tooth in the mouth. That is more damaged, no, because the whole of the tissue is damaged there. It is lying there. So don't get it like this. Don't get into that no action phase. Either you get the root canal treatment done or you get the tooth out. You only have two options. There is no in between option if the nerve is damaged. Okay. I hope I answered the question. Next question is it advisable to redo orthodontic procedure after the initial one malaligned? What can be done as an alternative to permanent retainer. Okay, let me give you this example. I show you this picture initially where she was 30+ year old and she was already got the tooth removed and she got the braces done when she was a teenager. Now when she contacted us, she was 30+. At 30+ age, what you are seeing here on the right side is we treated her without removing the tooth, without trimming the tooth in between. And you can see that how well aligned the teeth are. So she already got the tooth removed. Now we cannot say that, okay, this crowding is there, we will remove one more teeth. That is madness. We cannot do that. So if it has malaligned again, you can consult a holistic dentist, see about the other options. And this is the live example, our own case, where we could help her. She was 30+ when she contacted us. Okay, so it is possible. Next is it necessary to redo old mercury fillings? Yes, we recommend, because mercury filling, they are mercury and mercury is not good for our health. So we advise that you get the old mercury filling replaced with the new, more biologically compatible fillings. Next is, what causes the sealed cavities to decay from the filling? See, sealed cavity cannot have a new decay, but the sealed cavity can have the margin leakage. If the cavity field is having the leaking margin, then from the margin again the new cavity can develop. So it cannot, the decay cannot come from inside the tooth. It always comes from outside the tooth. The bacteria is outside the tooth. So even if you get the filling done, if after some time the margins are getting leakage, then from the leakage again the new seepage take place, and that can lead to the new decay in the old filling area. So you need to get it redo then, and that's why you need to get a checkup done every 6 months. Okay, this is again a very tough question. When we visit a dentist, how do we approach the consultation, and how can we assess if the treatment that are suggested are actually required or just a revenue generation for the dentist? See, first thing is you should see to it that the dentist whom you are consulting, he listens to your concerns and he explains to you what is the problem, why is the problem, and what are the solutions. Many times there are more than one solutions available. So the dentist should tell you that, okay, you have got these 3 options, option A, option B, option C. If you go to option A, these are the benefits, these are the limitations, option B. So they should explain to you all the treatment modalities after explaining you the problem and the cause of the problem and what are the treatment modalities possible, and each treatment's advantages and limitation. There is no ideal treatment. Whatever you will choose, you have to compromise on something. So the dentist should tell you all these things, and then your gut feeling will tell that, okay, this person is right for me or not. And if you're having any doubt, then obviously you are free to take second opinion, third opinion. And once you are clear that, okay, this is what, because see, we all have different likings, you know. So there should be a good frequency match between your service provider, your dentist, and yourself. And when that will happen, your gut feeling will tell you, sixth sense, that, okay, this is the right dentist for me, and I am safe. And yes, there will be the energy exchange, some charges, but that should be the treatment should be logically acceptable to you, right? Is vitamin K2 really linked to tooth health? Yes. Ideally, when the tooth are getting formed, like in the child up to age of 12 years, and for the wisdom tooth up to 17, 18 years, the milk is, the teeth are getting formed inside the jaw. At that point of time, K2 is important, but once the teeth have formed, they have erupted, by taking the K2, because enamel has got no regeneration capacity. Okay. So even if you take K2, then your new enamel can is not going to get generated if it is already damaged. So what are the red flags when it comes to dental health? Okay. So red flags is if you are getting so many of teeth getting decayed, you get it filled. Someone asks about the re-decayed. If again it is getting decayed, if your gums are bleeding, if your mouth breathing is there, if your mouth is smelling, and if you have the habit of doing the mouth breathing, and if you are snoring, these are the red flags. Okay, and it means that you need to consult a dentist. Are implants really necessary after the tooth removal? How safe are they? See, once the tooth is removed, you have two options. We have seen that you should get the tooth replaced after within 6 months of the removal of the tooth. So either you can get the fixed teeth on the adjacent teeth, but for that your adjacent teeth needs to be shaped, and for one tooth replacement you need to get 3-unit bridge. Or if you want to preserve the adjacent teeth, you get the implant done so that there are adjacent teeth are not trimmed also, and they are not overloaded also. Here, if you're getting the bridge, then the load of this tooth is distributed on the adjacent teeth. In the implant, the load is distributed on the implant. So that way, technically speaking, implant is a better option. Okay. Please throw some light on cosmetic veneers. Are they safe? See, cosmetic veneer, the name suggests, no, it is a cosmetic treatment. So if you are not happy with the color of the tooth, yes, there are some people who want to have the whiter teeth, or there are some people who want to get the smile designing, a Madhuri Dixit type of smile or something like that. So if that is your wish, then you get this veneers done. They are minimally prepared, so there are very superficial layer, thin layer is removed, and a ceramic veneer is prepared. So there are no function use of this thing. In fact, your function gets compromised because you are not supposed to bite with the veneer once you get the veneer done. Okay. But if you are really concerned about the looks, and if that is what gives you a good, self-esteem or something like that, you go for it. It has nothing to do with the function. It is purely an aesthetic treatment, cosmetic treatment. Are yellowing of the teeth connected to liver health? No. See, the liver issue can make your eyes yellow, or the tongue yellow, or the lip yellow. It cannot make the teeth yellow. Yellow teeth means your superficial layer of enamel is lost. Okay, it has nothing to do with the liver health. Are there any materials in dentistry that we should avoid? Yes, you should avoid the material which are containing mercury. Okay, so mercury feeding is absolutely no. And preferably you should use something like ceramic or lithium disilicate. Ceramic material is very good. It is biocompatible. Okay. Okay. So this ends with all the questions that were shared with me by Delphin ji. And we are more than 1.5 hours in
Okay,
the
yeah, more
presentation.
questions are there for Dr. Rakesh here. Can broken teeth regrow by enlightening?
No.
Okay,
Broken teeth cannot see if we cut the skin will unite. Even if we break our bone, the bone will also unite. But because the cells are there. See, if you cut your liver half, the liver will regrow. See that those cells are there in the liver. If you cut your kidney, the kidney will not regrow. If you cut the liver will regrow. That is the property of the liver. So the property of the tooth is there. Once the enamel is lost, it is lost. There is no way it can regrow. When I say this, people start sending me some YouTube video or some Insta post. I say, no, I see this. It doesn't work that way. I have said this at various platforms. And with due respect, I say this again at this platform. If someone wants to taste this thing, I am ready. let us evaluate it. You share your current picture of the tooth, broken tooth, and you share your current X-ray of the tooth. And you experiment with whatever you want. You want to use some herbs, you want to use some energy, healing, or whatever you want. You do. Let us see for 3 months, 6 months. After 3 to 6 months, we will again take the picture of the tooth. We will again check the X-ray of the tooth. And let us see if it has regrown or not. Until and unless you are showing me your own tooth to be done like that, my statement is that the tooth cannot regrow. But if you can challenge, if you can challenge me and if you can show me the tooth is regrown, I will be more happy than you. So I request you to prove me wrong. Let us take this challenge. I see my number is there. You can take my number from Susan ji, Delphine ji also. You connect with me. Let us do this experiment. Let us see if you can regrow the tooth.
Okay, thank you. Thank you very much. And Dr. Prema Devraj has given you very appreciation that it's a very enlightening. Thank you very much. Thank you, Dr. Prema, for coming and joining with us. Bharat is asking, does filling contain fluoride in India?
Yes, there are the filling that are called as glass ionomer filling. So glass ionomer fillings are having the fluoride into it. So if you don't want to get the fluoride, you have to tell your dentist that please don't do the filling with the glass ionomer. You can go for the composite filling. Composite filling does not have the fluoride generally.
Okay, that's a great information. Next is Teresa. Teeth regrow, regenerate, that you have already answered. And Himani Goswami is asking, RC is good
I think we
or
covered this
not
root
to
canal.
be done?
RC is root canal. So I think root
Okay,
canal we have already discussed,
already
right?
covered. Okay, the another one, Bernard is asking, would you recommend use finger instead of brush? As
Yes, I get this question many times. So I tell you, if you want to clean, if you want to sweep your floor, do you use a stick or do you use a broom? Can you clean the floor with the stick or do you need to use the broom? Obviously, the broom will clean the floor more effectively. So, see, the finger is good for the gum massage. If you want to massage the gum, finger is good. But if you want to clean the teeth are irregular. No? There are some thin ridges in between the teeth. So there your finger cannot go there. There the brushes will go. So it is better that you brush the teeth.
absolutely. And yeah, the fingers can be good for massage. Otherwise, you have to even the with the wood what the plant ka aata hai na jo datun, that you have to
Yes.
really bite it and make it into brush and then use it.
Yeah, ultimately it is a broom like thing. Yeah. So
It is a
you need
broom.
the bristles basically that will go inside the teeth.
Absolutely. Thank you very much. Amit is asking, I am a cleft palate case and gone through orthodontic treatment, root canal and wisdom teeth extraction at the around 50 age. Any recommendation to maintain the teeth balance?
Yeah, see, yours is really a challenging case. We understand. Okay. Uh, but yes, you need to, if your teeth are right now, whatever they are remaining, if they are in good condition, you need to have reasonably chewable food. Like even if you take the salad, you chew something, right? So if you give them good function will keep your teeth and gums more healthy. Okay, that's
Correct.
what, because I don't have your X-ray or something like that. That is what I would recommend, that you give them good function and maintain. You can start doing oil pulling if you're not doing. Okay.
Okay, Amit, you can be in touch with Dr. Saab. His number is here. Himani Goswami is asking, is glass tooth is a good option?
Yes. Glass is ceramic. That's what I said. No, this is lithium
Okay,
disilicate ceramic is a good option. Yes.
great. Thank you very much, Dr. Prakash. Catherine is saying, and then Shilpa, can you throw some knowledge on water flossing?
Yeah, water
Is
flossing is
good.
good. Water flossing is good. It will go in the
Okay.
area where even the tooth is not, your brush is not able to go in some areas. So water flossing is good. Yes.
Okay, Berlani, you can find the recording with me where Delphine can help you to get it. Then Abhishek, my mother had started new teeth, but that got broken. Okay,
So this is not
so
very
what
clear.
to do?
Started new teeth means what?
What it is?
It is not very clear,
Okay.
Abhishek ji.
Absolutely. Your question is not very clear. Very nice session. Thank you, doctors. Saying
Thank you.
Yogini and Bhavana. Good. Is there any specific purpose of any side of breathing, such as left side or the right side breathing?
Yeah, see, this is not a seminar on the breathing, but yeah, there is something called as Ida Nadi and Pingda Nadi. Yeah, and then there is some
Okay.
Sushumna Nadi. So yeah, there are, and you need to take both are needed to live a life. You only left or only right doesn't work that way. You need the balance. See the crux of the whole presentation is the balance,
Yeah.
isn't it?
Absolutely.
So nothing in
Absolutely.
excess should be avoided. So balance is the key. So yes, left and right side breathing should also be balanced.
Absolutely fantastic. All the questions are over. Thank you very much, Dr. Rakesh, for giving such an enlightening holistic dentistry. And as a cellular detox expert, yes, I will put the entire thing under your mechanical method of detox. It needs to be managed well. Fantastically explained that. I always tell my patients there are 7 methods by which your cells detox. So this is one mechanical method is one of them, and how it works on your entire dentures, teeth, and all your body. Holistic dentistry is such an amazing concept, and I am so glad to be connected with you for this, and we will look forward to be connected with you continuously, because our whole purpose is achieving health, the complete health, so that our prosperity and our peace may be sustained. हमारी जो
Yes.
स्वास्थ्य है, और वो सबसे पहले हमें अचीव करना है। जब स्वास्थ्य सही रहेगा तो समृद्धि और समाधान हमारे साथ टिका रहेगा। देन वी कैन
Same.
एंजॉय आवर लाइफ विद एडवेंचर्स। हमारी जिंदगी में साहस के काम होना चाहिए। वी हैव टू एंजॉय लाइफ विद एडवेंचर्स अनलिमिटेड एंड लिव अ फुल एज। No one needs to die of disease or disputes. Okay,
Yes,
we
true,
need to
true.
end our life with happiness, with aging, and or adventure with accident. That's fine. Whatever it is, happiness is so important, and smile is so important. It's so nice to see that dentistry can happen even without extracting. Fantastic. I wish I knew you before when my child was young. That time nobody used to talk about the holistic dentistry.
Yes.
But very nice to see. I will see that all my grandchildren, if they have any problem, they must get connected with the holistic dentist like you. Thank you very much, Shekhar, for helping us to coordinate this. Thank you, Delphine, and thank you everyone who have come here. I will not be able to take everyone's name, but each one of you are very much loved by us, and we want you all of us to become awakened about with the right knowledge, because the information will form our thoughts in power, and then it has to connect with positive emotion to produce all the 5 medicines in our mind, isn't it? Thank you very much, Dr. Saab, to help us to produce this amazing medicine in our mind, to know about dentistry so beautifully, and keep smiling and spread the happiness all around. Thank you, everybody. We
Thank
will
you. Thank you
say
very much.
good night and have a wonderful night and wonderful life. God bless you.